Good morning, everyone. It may be cloudy outside, but there's a huge sunshine at the Sinclair School of Nursing today. I want to welcome you, welcome everyone. This is an exciting day for us at the Sinclair School of Nursing and for the entire University of Missouri. I'm Judith Fitzgerald Miller, and I'm very privileged to be the Dean of the Sinclair School of Nursing. And yeah. Thank you, Ann Deaton. And I'm also privileged to work with such an outstanding faculty and staff that you'll learn a bit about as we move on this morning. I want to thank the staff of Tiger Place, our Aging in Place partner, for hosting this lovely special event. This is a facility for our faculty to practice and develop new cutting-edge care delivery models for caring for older adults. Lots of discoveries have taken place here. Some of them have been taken to commercialization, which isn't in my script. I fear going off script because I'll hold you here a long time if I told you about all those wonderful discoveries, all geared to helping older adults age in place and be safe. We also want to acknowledge our AmeriCare partners in this endeavor. AmeriCare owns the facility, and the Sinclair School of Nursing provides the care for the residents in this facility. I want to introduce to you some special officials here today. The University of Missouri System President, Mike Middleton. If you could hold your applause. And Mike, could you stand so everybody can see you? He has many demands on his time, and we so appreciate. We really appreciate your being here. We know you've got many, many things vying for your time. Our University of Missouri Chancellor, Hank Foley. Our Executive Vice Chancellor for Academic Affairs and Provost, Garnet Stokes. I'm sorry, I've worked on your first name, so it's Garnet Stokes. Vice Chancellor for Research, Mark McIntosh. Our Associate Dean for Research, Vicki Kahn, is around somewhere. Vicki, back there. Our Associate Dean for Academic Affairs is Janice Hoffman. Our Dean Emerita, Rose Porter, is here. Rose? And Ann Deaton, could you stand? She's our First Lady from our previous Chancellor. So I think that all of you are really important, and I would love to mention each of you by name, but I just don't have time. I do want to give a little historical perspective. You may recall in 2012, the Sinclair School of Nursing received the largest research grant in the history of the University of Missouri. At that time, it was $14.8 million to launch the CMS initiative to reduce avoidable hospitalizations among elderly residents in nursing facilities. CMS stands for the Centers for Medicare and Medicaid. This project was developed and implemented by Drs. Marilyn Rance, Greg Alexander, Marcia Fleschner, Lori Popejoy, and Amy Vogelsmeyer. All are faculty at the Sinclair School of Nursing. I just love them. I'm so proud of their work. This team of energetic, skilled researchers from the Sinclair School of Nursing came together and built an interdisciplinary team and successfully wrote an application for this grant in just 10 weeks. This was an intense effort, not only pulling together the materials to meet the criteria for grant application, but they also built successful collaborations and relationships and gathered willing partners in 16 nursing homes in St. Louis. What an achievement this grant work has been. They, with their partnering facilities, have had outstanding results. And just a few weeks ago, CMS recognized their major accomplishments for reductions in all-cause hospitalizations by 35%, and a reduction in potentially avoidable hospitalizations by 39%. These reductions saving CMS millions of dollars. Then, at the beginning of their 4th year in this successful grant, they were asked to write a proposal to CMS and to do it in just 8 to 10 weeks. They were still running the current project. Again, what busy scholars to take this on. The basis for their current proposal is to use the interventions of coordinated care and early detection of illness, as well as protecting those at risk for health problems so that hospitalizations are avoided. Now some 32 nursing homes will participate in the new study, divided into two groups, 16 receiving the current Missouri Quality Initiative interventions, and the other 16 receiving routine care, the attention control group. The intervention homes will receive that coordinated care model, as I said, and others will receive routine care, but both groups will receive a new reimbursement model for nursing homes. And the researchers will determine which group getting the CMS payment results in fewer hospitalizations, and again, cost savings. This team has saved Medicare and Medicaid millions of dollars, and now they'll develop and test a new funding model. Advanced practice nurses are central to implementing these interventions. The work of the team will have a national impact. This grant is bringing national recognition to the School of Nursing and to the University of Missouri and to the entire state of Missouri. Words cannot express the magnitude of the work of this team. Their efforts to improve care for older adults has been exemplary. That care is now influencing national policy. How great is that? I want to thank you, the team, for all that you do for older adults care and for our Sinclair School of Nursing, this university, and the state of Missouri. Now it is time for me to present to you Chancellor Hank Foley to make today's important announcement.
Hey, good morning, everybody. Thanks very much, Judy. I really appreciate it. Whenever there are this many nurses in one place, there's always sunshine, right? So I'm really pleased to be here, and I'm just going to take a moment to say a number of reasons why, but one of the key reasons is when I was at my previous institution, I had this dream that maybe we could get nurses and engineers together and we could create a place, you know, sort of the Nittany Lion place, right, where people would get extremely good care, and we thought we were so ahead of the curve. And then I came here, and they'd already done it. And I was absolutely delighted. I can't tell you how delighted I was. Now, avoiding hospitalizations is important for all of us, but particularly for those of us who are more frail and more vulnerable. Those people who are living in our nation's nursing homes fall into this category, of course. There are almost 16,000 nursing homes in the U.S. with 1.4 million nursing home residents living in them each day. Nearly all of them are Medicare beneficiaries. They're in need of nursing and medical care, and they're at risk for potentially avoidable hospitalizations. Now, most of us in this room may need nursing home services at some time in our later years. Some of us a little sooner than others, perhaps, you know. The outstanding team assembled of the School of Nursing, which includes Dr. Rance, Alexander, Flesner, Popejoy, and Vogelsmeyer, together with the School of Social Work, represented by Dr. Galambos, and their collaborating 16 nursing homes who've been working on the current MOQI initiative, which is called the Reduction of Avoidable Hospitalizations Among Nursing Facility Residents, have done a great job, a truly outstanding job, in achieving the goals that were set by the CMS. In fact, the MOQI initiative, try saying that quickly, by the way, was just recently recognized by CMS for leading the results of the 7 sites in this national work. That's really just outstanding. And I want to congratulate them and ask all of you to give them a round of applause and congratulate them. Now, what I'd like to do is ask Dr. Rance and Miller to come forward and to stand next to this poster, because the real reason we're here today is not to look backward, but to look forward. And we're announcing the next phase of this work. That work is now called the Initiative to Reduce Avoidable Hospitalizations Among Nursing Facility Residents with Payment Reform. And this now sets a new team record for funding of, get this, $19.8 million. $19.8 million, folks. That's Missouri taxpayer money that went to Washington and came back to Missouri because of these folks. That's good for us. It's good for the university. It's good for the state. It's good for everybody. Just think, if this weren't here, what if Mizzou weren't here? What if Tiger Place were not here? Think of the difference it would make in all of your lives and our lives. So at this time, I want to introduce Marilyn Rance, the leader of this team and initiative for both Phases 1 and Phase 2. Hold on. She is so energetic, I'll tell you, which I love about Marilyn. She is a Curatus Professor of Nursing at Mizzou. She is a national and internationally recognized leader in long-term care. She's a member of the National Academy of Medicine, which for those of you who are a little older, maybe you recall it as the Institute of Medicine. And she's exemplar in grant writing success. In fact, it's astonishing. She's now generated more than $80 million for her research and research teams and colleagues. Marilyn, you're outstanding. Thank you so much for being a Mizzou Tiger.
Wow, this is really fun. You wouldn't believe how hard it's been to spend $15 million. I can't imagine how hard we're going to have to work to spend 20 now. Oh my, but it's good for Missouri, and it's good for the University of Missouri, and it's terrific for the Sinclair School of Nursing, and it's terrific for the School of Social Work too. Thank you so much. We have a wonderful, wonderful team, and I just can't thank everybody enough. Would the members of our team please stand up? Our MOQI team, I think it's pretty impressive. We have several people here today, and Amy Vogelsmeyer is standing in the back, and Lori Popejoy, and Marcia Flesner, and Dr. Galambos, and then we have two of our APRNs next, or three actually, Deva, and Bertha, and Marcia, and Joanne are here from facilities, so if anybody wants to interview an APRN, they're right here. Yes, and on this side we have other members of the team. Adrian, who is specializing in, she's the social worker and in care transitions, and Mary Ann, who specializes in the Interact and the QIPMO, the quality improvement process. Sue Shoemate, who specializes in health IT, and oh gosh, Janice, our data person who helps us in getting those reports done. Linda Green, who helps us keep that budget going. Oh, that's complicated, and keeps us all out of jail. And I see Greg Alexander, who's the lead for the health IT component, and Deb Finley, who's going to help us lead billing and helped us in the last grant. And we couldn't do anything without Jessica. Jessica's our air traffic controller. So, thank you. We also have members of the representatives from 3 nursing homes who are here today. We have from Delmar Gardens, Merrimack Valley, and we have from, and if you want to stand up, please, and then we have from NHC Deloge, Jackie, and Festus, Sharon and Bambi from Festus Manor. So we have 3 of our nursing home administrators and other administrative staff who are here. We thank you so much for driving over. Because without these facilities, these 16 facilities that have worked so hard and partnered with us, the success of this grant would not have been possible. And the whole point is to see that when you need a nursing home, that things work really well and you get good quality care. That's our objective. And that's been the result of this work. And I'm excited to be able to go on and see what effect we can get from improving the payment. I can't believe CMS is willing to let us test a new payment model. And so we're poised for the next phase. We're ready to work. And we just thank you all for coming. And we're so excited for the school, for the University of Missouri, and for the state of Missouri today. I'd like to introduce Karen Muckler, who is the executive director at Delmar Gardens. Merrimack Valley and Chesterfield, and she will give you some comments about what the MOQI project has meant. That's our shorthand for the Missouri Quality Improvement Project initiative here in the state. And so, thank you, Karen.
Thank you. Thank you, Dr. Rance. Good morning, everyone. Thank you for having Del Mar Gardens and all of our other skilled facilities and friends here today. I can't tell you what an amazing journey it has been to be part of this initiative. And the advancement that we have all made together as a team speaks volumes for what the initiative has tried to do and successfully done, and what we plan on doing in the future with rehospitalizations. To give you an idea of where we started, we learned how to integrate the APRNs and into our clinical care teams. So we've already had a comprehensive approach, and this just added another level of expertise that was so much needed for us to go to these levels to achieve these outcomes for our dear residents. And I think that you're absolutely right, Dr. Rance. We all have so much to gain in the field and being part of this initiative, but ultimately our residents and our families are all benefiting so much from the education that the program has provided for us, the education that the APRNs provide day in and day out to our staffs, navigating conversations with the physicians, talking about advanced directives and healthcare decision days. So I could go on and on about so much that we have done, but let me give you an example of just a little bit of the data that we've been able to achieve with Del Mar Gardens and Merrimack Valley, and we have an outstanding team. Dava is our nurse practitioner through the project that has been assigned to us, but we feel that we've really embraced that component, so she's part of the Del Mar Gardens family, and that approach has also helped with our success. To share a little bit with you, as far as reducing hospitalizations, our staff and the MOQI staff, we have said, have done a remarkable job. To share with you, our hospitalization rate has been at or below goal 9 months of the 14 months. That means that we have had less than 1.3 hospitalizations per 1,000 resident days, which is ginormous. And we're really, really proud of that number. I will share with you that of those 9 months, 1 month we had 0 hospitalizations, and you can imagine the celebration and the party that our management team had with our nurse practitioner. That's remarkable. Starting from ground up in the skilled care facilities, taking on the level of care that we're taking today, and the chronic conditions that we're challenged with and the fundings that we're challenged with, and being able to put that together, and together with the Interact tools and the leadership meetings and all of the support, we've been able to demonstrate we can do this. We're looking very forward to the next 4 years and doing a little bit more of the same and getting better at it, and hoping that everybody can kind of copycat our success. So again, thank you all, and thank you, Dr. Rance.
I just wanted to reiterate that this team had the best outcomes of any CMS-funded grant. So this is really remarkable. And it's also remarkable that they have been, our federal government has invested in them once again with a whole lot of money, $19.8 million, to achieve even better outcomes and to save more funds for CMS. So we're really pleased with this project and their important work to improve nursing homes, and proud of Phase 1 accomplishments, and know we're going to have great outcomes for Phase 2 as well. So watch us at the Sinclair School of Nursing. We're going to continue to shape healthcare. Watch us, because we're going to have accomplishments that'll blow your mind. Again, I thank you for coming here today. Our special team has had fabulous outcomes and fabulous work, as I said, so you need to be watching the news in terms of what they can do. We have refreshments for you in the other room, so stay and enjoy refreshments. Have a toast to our wonderful team. And again, we appreciate you joining us today. Thank you.